Good morning to everyone, to Abdiel, who joins us today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of 2 people with COVID-19 yesterday. The first was an 82-year-old man from Ciego de Ávila and the municipality of the same name. He had symptoms of the virus and underwent a PCR test. The patient also suffered from some pre-existing medical conditions. He was admitted to hospital on September 9th for shortness of breath. The patient spent 8 days in hospital, 3 of these in intensive care. His health began to deteriorate significantly after developing complications on September 16th. Yesterday, September 19th, he suffered cardiorespiratory arrest and, despite attempts to revive him, sadly died. We offer our condolences to his family and friends. The other patient was a 94-year-old man from Havana. Despite his advanced age, this patient did not suffer from any notable pre-existing health conditions. Nonetheless, he spent only hours in hospital. He was admitted with difficulty breathing and a fractured hip. While awaiting surgery, he began to suffer from a series of complications, which ultimately led to his death. Once again, we offer our condolences to the family and friends of the deceased. Today, 8,016 people are hospitalized in Cuba. 6,162 are under observation. There are 1,292 suspected cases and 562 confirmed active cases. Yesterday, we processed 6,742 samples in our various molecular biology laboratories. 2,108 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 928 in Havana's Hygiene, Epidemiology and Microbiology Center, 852 in Villa Claras, 383 in Santiago de Cubas, 470 in the Genetic Engineering and Biotechnology Center Lab, 432 in the Manuel Fajardo Hospital, 406 in the Molecular Immunology Center, 362 in the Naval Hospital, 324 in the Fructuoso Rodriguez Hospital, 300 in the ICA laboratories, and 149 in the Civil Defense Labs. Of the 6,742 samples processed, 36 tested positive for COVID-19. That's 36 people. This brings the total number of samples processed in the entire country since the pandemic began to 538,652, of which 5,091, or 0.95% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested, the most from Havana with 4,146, Ciego de Ávila 1,056, Mayabeque 296, Matanzas 276, Sancti Spiritus 236, Santiago de Cuba 249, and so on and so forth from all of the country's provinces, from all of the country's territories. Of the 36 positive cases diagnosed yesterday, 34 are Cubans and 2 are foreigners, 1 a resident in the country and the other a visitor and therefore an imported case. 28 or 77.7% of the 36 positive cases yesterday are confirmed case contacts. This means that 4,588 people, or 90.1% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus. This is the group at highest risk of infection. Of the 36 cases diagnosed yesterday, the source of infection linked to 7 is yet to be determined. The source of infection in 63 cases reported over the last 15 days is therefore still being investigated. Yesterday, as I mentioned, one person to have tested positive for the virus contracted it abroad, meaning that imported cases rise to 440, or 8.6% of all diagnosed cases on the island. Of the 36 diagnosed cases yesterday, 14 are male for 50.2% of all cases, and 22 are female, representing 49.8% of all diagnosed cases on the island. 22 or 61.1% of the 36 cases yesterday were asymptomatic at the time of testing. Overall, 59.4% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 64.2% of cases over the last 15 days. By age group, 4 positive cases diagnosed yesterday are under the age of 20. In fact, all are under 18, for a total of 540 children or pediatric cases to have tested positive for the virus in the country. Of these, 460 or 85.2% have recovered from the virus and been discharged from hospital. Meanwhile, 14 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 10 cases are between 40 and 59, and 8 are over the age of 60. Of the 36 cases diagnosed yesterday, 16 belong to Ciego de Avila, one of which is an imported case. 9 belong to Havana, 6 to Matanzas, 3 to Artemisa, and 2 cases to Sancti Spiritus. As I mentioned, the imported case was detected in the municipality of Moron, Ciego de Avila province. Of the 36 cases, the 3 from Artemisa belong to the municipalities of Caimito with 2 and San Cristobal with 1 case. The 6 cases from Matanzas belong to the municipalities of Cárdenas with 3, Matanzas 2, and Calimete with 1 case. The 2 cases from Sancti Spiritus belong to the municipality of Yaguajay. The 16 cases in Ciego de Avila belong to the municipalities of Ciego de Avila with 12, Majagua with 2, Bolivia with 1, and 1 imported case belonging to Moron. The 9 cases from Havana belong to the municipalities of Marianao with 4, and 1 each to Arroyo Naranjo, Plaza de la Revolución, Centro Habana, 10 de Octubre, and Habana del Este. To summarize, of the 5,091 people who have been diagnosed with the virus thus far in Cuba, 562, or 11%, are active hospitalized cases. Of these, 547, or 97.3%, are clinically stable. Yesterday, as I mentioned, 2 people died as a result of the virus, meaning that the COVID-19 death toll on the island now stands at 115, with a mortality rate of 2.24%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 128 people were discharged from hospital, a positive result in comparison to the number of positive cases diagnosed yesterday. One person was discharged in Pinar del Rio, 11 in Artemisa, 68 in Havana, 2 in Matanzas, 4 in Sancti Spiritus, 39 in Ciego de Ávila, 1 in Camagüey, and 2 in Santiago de Cuba. This means that, to date, 4,412 people, or 86.7% of all confirmed cases in Cuba, have recovered from the virus. Today, 4 patients being treated in Havana and Camagüey continue to be in a critical state. 11 patients in hospitals in Havana, Camagüey, Villa Clara, and Matanzas are also reported as serious. 2 new patients joined the group of those reported as serious yesterday, while 3 serious patients passed to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 325,950 people were diagnosed with the virus, for a total of 30,540,446 confirmed cases since the start of the pandemic. Yesterday, 6,059 people died of the virus, for a total of 952,724 COVID-19 fatalities and a mortality rate of 3.11%. The region of the Americas, which accounts for 50.74% of all cases worldwide, reported 133,730 new cases yesterday, for a total of 15,496,955 people to have been diagnosed with the virus. Meanwhile, 3,336 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 528,504 and a mortality rate of 3.41%. The United States continues to top the list of countries worst affected by the pandemic, with over 6,724,000 confirmed cases and 198,589 COVID-19 fatalities. India has over 5,308,014 cases and 89,619 deaths. Then Brazil with 4,495,186 confirmed cases and 135,793 fatalities. In 4th place is Russia with 1,091,186 cases and 19,195 COVID-19 related fatalities. From the Americas, after the United States and Brazil, comes Peru, Colombia, Mexico, Argentina, and Chile as the countries with the highest number of cases in the region. Regarding mortality rates, Mexico has the highest, standing at 10.56%. This is the information we have on the behavior of the pandemic in Cuba and the world.